Are you thinking about quitting your hair loss medications like Finasteride or Minoxidil? Then you must watch this, because I understand that you might think these medications are no longer working to address your hair loss, or you might also have an underlying side effect from taking these meds. We're going to talk about the pros and cons of stopping hair loss medications, and I will give you my recommendation at the end of the video as to how one would quit their hair loss meds. For those of you who are new to the channel, my name is Dr. Ross Kopelman. I am a hair transplant surgeon, and as you can imagine, I prescribe a lot of hair loss medications. Now, hair loss medications do work to prevent further hair loss. Typically, I prescribe Minoxidil, which helps to thicken the hair follicle. It also prolongs the growth phase of the hair. And then Finasteride or Dutasteride, which are DHT blockers. DHT is a major contributor for hair loss for both men and women. And so if you can block the buildup of DHT, that's a major win to prevent hair loss. And actually, you can reverse some hair loss by using these medications. Now, the downside to using medications is you can develop side effects. And I've spoken about side effects for Minoxidil and Finasteride in another video that I would encourage you to check out. But what I want to spend a lot of time emphasizing right here, right now, is that these medications work. But I want to tell you a little story. Typically, what I see is a young male who's been on Finasteride for 2 years, and they got some benefits of being on the medication, and then all of a sudden they get a plateau. And because they get a plateau in the benefits of the medication, they stop. They decide they're going to quit because they don't think the medication is working any longer. And then what happens is they're off the medication for about 2 years, and then they realize their hair loss is worse than it was before they started hair loss medications. And then they scramble and they try to go back on some form of hair loss medications, but they can't ever get back to where they had been before. This is a very, very typical story that I hear frequently. And the reason why this is happening is very simple. When you start hair loss medications, whether that's Minoxidil, Finasteride, or a combination of the two, what happens is you have a big ramp up upwards. What do I mean by that? Well, you have these little vellus baby hairs that you can't see with the naked eye. You need to use a trichoscopy device to look at these little baby small hairs up close. When you use hair loss medications, that's typically where you're going to get new growth. You're going to prevent hair loss. And so what happens is everyone who starts hair loss medications typically sees this ramp up. They see their hair getting thicker and longer, and areas that they were experiencing hair loss start to sprout new hair. But then what happens is there's a plateau. And that plateau happens when there's no additional vellus hairs on your scalp because all those little baby hairs have now become big, thick hairs. The plateau is when we tend to see patients decide they're going to quit because they think the hair loss medication is no longer working. But that's false. It's a false story because the hair loss medication is helping to thicken the hair and prolong the hair and keep the hair healthy so it doesn't become vellus. Once it becomes vellus, those hairs can fall out and they're gone. And once hair falls out, it's gone and it's gone forever. So that is one of the reasons why I just want you to have an appreciation for the fact that these hair loss medications work. You may not think that they're working once you've been on them for a couple of years. But there are also reasons to stop taking medications like Finasteride or Minoxidil. Finasteride sometimes can cause an underlying erectile dysfunction, ED, libido. Sometimes it can cause you to have anxiety or depression, gynecomastia. Minoxidil sometimes can be irritating if you're using a topical alcohol form or sometimes even the foam. Or if you take the oral pill, that might cause you to have hair growth in unwanted places, especially if you're female. This can be quite annoying. I understand why these side effects can be frustrating, and I'm not dissuading you from stopping taking these medications if you're having side effects. You should absolutely consider either stopping the medications or microdosing how often you take these medications. And the other reason to stop is because you just don't want to take medications, and that's okay. Not everyone wants to be on oral medications or topical Rogaine their entire lives. It's totally understandable. So if you're thinking about quitting hair loss medications, my recommendation is do not do this cold turkey. Don't just stop because you'll activate a telogen effluvian state where you'll have excessive shedding of your hair. And this can happen because if you're using Minoxidil, for instance, it's prolonging the growth phase. All of a sudden, you don't have that activator to prolong the growth phase of the hair, so the hair will start to shed. And in a similar way, if you stop using Finasteride or Dutasteride, these DHT blockers, you're going to have a spike in DHT, which is going to cause miniaturization of hair follicles. So this can happen pretty quickly if you don't do a gradual removal of these medications. So let me go through my recommendations for how you should stop these meds. So to avoid that rapid shedding, it's better to do things gradually. Now, when it comes to topical minoxidil, when you want to stop this, the first thing we have to do is, are you using this twice a day? If you're using it twice a day, I want you to decrease that to once a day and do that for 4 weeks. I then want you to do this every other day for another 4 weeks. And then after that, you can go to twice a day and you do that for 4 weeks. And after that, completely stop. If you happen to only be using this at the moment once a day, then start using this every other day for 4 weeks. And after those 4 weeks, use it twice a week for 4 weeks and then stop. And then if you happen to be on daily oral medication for minoxidil, I want you to start taking the medication every other day. Do that for 4 weeks and then cut it down to 3 times a week and do that for another 4 weeks and then cut it down to twice a week and do that for another 4 weeks and then you can stop. And then when it comes to finasteride, I want you to take that pill every other day and do that for 4 weeks. After that, you're going to take the pill 3 times a week and do that for another 4 weeks and follow that by taking finasteride twice a week and do that for another 4 weeks and then completely stop. This approach to stopping medications for your hair loss is going to help you prevent that excessive hair loss shedding event that would happen if you went cold turkey. This gradual approach to stopping hair loss medications decreases the likelihood that you're going to have excessive hair shedding when you stop your medications. That's why I don't typically recommend stopping cold turkey unless you're really experiencing underlying side effects that are causing you to have medical issues that you need to stop immediately. I hope that you found this helpful and now you have a better appreciation for the importance of hair loss medications to help prevent further hair loss, but also have a very good understanding of how you can stop hair loss medications in a way that you can help avoid a telogen effluvium, excessive hair shedding. If you have any other questions that I've not addressed, please leave them in the comments below. Please hit that subscribe button because we're trying to grow our community. And as always, I'm here on your journey to help you address your hair loss.